Good afternoon, ladies and gentlemen. It's my honor to sit beside Dr. Vishal Garg, Senior Consultant, Gastroenterologist, Liver Specialist in Noida region. He's practicing in Apollo Hospital, Sarita, Noida, and Yatharth Hospital, Noida. Today, I feel honored to sit beside to him. Being our existing user, he would like to share his point of view on FibroTouch liver scan machine. Sir, I would like to ask that why there was a need of such machine when there were traditional methods like LFT, ultrasound and elastography.
This is a very important question. Actually, necessity is the mother of all inventions. Various studies have documented that LFTs, including SGPT, was a very imperfect marker of liver histology. Even with full cirrhosis of liver, the LFTs used to remain normal and we never used to pick up sometimes liver inflammation in patients by just using an LFT. Other methods which were available to us were liver biopsy, which is again a very painful and an invasive procedure. In a private setup, the cost will almost amount to 30,000. Secondly, biopsy is not reproducible easily. I cannot force my patient to get a liver biopsy done every 6 months or every 3 months just to assess the improvement in liver fibrosis. The second limitation with liver biopsy was that the tissue size was very small. We used to get a small tissue of liver with 2-3 cores of liver, which was very inadequate for comment many times. However, we still felt that liver biopsy was gold standard. But this non-invasive FibroTouch, which is liver elastography, has shown excellent results comparable to liver biopsy. The main advantages with this equipment is that it is very easy to do follow-up scan. The patient has to just come walking in the OPD. Any preparation is required. We just have to do the test. The test takes hardly 2 to 3 minutes to perform. Our operators are trained now to perform the test and we easily reproduce the test. So this was actually the need for liver elastography because the existing tests were not diagnosing the liver condition properly.
So as I have seen nowadays, not only gastroenterologists, the reach of this machine is going to general practitioners, radiologists and endocrinologists. So what is your take on it? Is this machine becoming like an essential tool in NASH, NAFLD, ALD, Hep B, Hep C, or we need more research so that more and more specialties can get access to this technology?
It is a very important question. It is an essential part in day-to-day liver practice. For me, non-alcoholic fatty liver is actually not a liver problem. This is a metabolic problem. Majority of diabetics, they have non-alcoholic fatty liver. And in my opinion, I have started believing that this is a very good equipment for preventive liver health. Once we have developed cirrhosis of liver, our hands are tied up. We cannot reverse and establish cirrhosis completely. However, yes, we have seen encouraging results with current pharmacotherapy that even established cirrhosis can be reversed in hepatitis B, hepatitis C, alcoholic fatty liver and even in non-alcoholic fatty liver. But fatty liver is actually not a liver problem and this is a very good thing for a preventive health checkup. In my opinion, everybody who has fatty liver should undergo liver elastography using FibroTouch, so that we can know what is the current condition of liver. However, the only limitations again happen in a practice is cost constraints. Many patients are not very supportive, they don't upfront want investigations. But yes, the reach has increased. I've seen a lot of endocrinologists, physicians using liver elastography, FibroTouch and generating fibrosis reports. So the reach is good.
Another thing which I feel is, as NASH is a boiling issue and there's nothing which is there in market to diagnose NASH. Through ultrasound we can get just an indication that if a person has major fibrosis or a...
No, ultrasound cannot give you indication. Ultrasound can only tell you about fat in the liver.
Okay, so you mean that still there is no more technology than FibroTouch liver transient which can tell whether the person has a higher value of fatty count?
I will reframe it. There are other technologies also. Okay. There have been a lot of serum markers. There have been a lot of algorithm based tests where platelet count, ALT, a lot of blood test fibrinogen levels were used, to develop fibrosis scores. But they were not found very reliable, particularly in the Indian population. For me, I feel this is the most useful test, liver elastography or the FibroTouch, because it can be done in an OPD practice and does not require any invasive sampling. Not even a blood test is required. And second advantage is you can accurately diagnose liver fat also. So for me, I don't need an ultrasound for liver now. For me, for fatty liver, FibroTouch does both the things. It diagnoses fat in the liver also and tells us the damage in the liver also. So for a liver specialist, we don't need ultrasound for fatty liver anymore.
So, sir, when we meet a lot of radiologists, GPs, and sometimes even gastroenterologists, they say that we undergo ultrasound and we are happy with the result. We don't need a fibroscan. But I feel in today's world, it is like a stethoscope of any gastroenterologist, FibroTouch.
Yes.
So, for such colleagues, what message would you like to impart?
This was the ignorance we had 15 years back.
Yes,
You know,
sir.
we did not have liver elastography 10 years back.
Yes, sir.
There were ILBS was the first institute in Delhi to
Yes.
have liver elastography in 2010.
Yes.
You know, so that is when technology came to us. So still people not aware of this, but yes, we have so many educated people coming to us. They themselves ask for a liver scan. They say, do my fibroscan. I want to assess my liver status. You know, so ultrasound cannot diagnose fibrosis of liver. For fibrosis of liver, fibrosis assessment, cirrhosis assessment, we need liver elastography.
And sir, I have also seen that there are a lot of pharma companies who are doing camps with both FibroTouch and FibroScan. But a lot of doctors feel that once a month is not enough. That's why they purchase their own equipment. So can you impart some knowledge to your fellow colleagues that why a 24/7 dedicated tool is essential for them?
The same reason we had it purchased it in 2019.
Yes,
We
sir.
also had the same problem. There were many people who were coming to us. They were offering us this equipment once or twice in a month for a camp. But the logistics issues are very different. You know, I have a patient coming from Aligarh, from Bulandshahr or from Muradabad, and I say you come back again after 2 weeks for a liver scan. You know, for a scan of 3,000 rupees, the patient will end up, you know, having a travelling expense of 5,000 or 10,000. Plus, we will have to wait for 2 weeks for the result. So, because the previous equipment was exorbitantly expensive, we could not afford it. So that is why we never thought of putting up a liver elastography, fibroscan or FibroTouch at our clinic. But once we met Mr. Rachit and his father in 2019, we could, you know, manage somehow the finances and we installed the equipment at our clinic. And I will tell you, if it is available in-house, the patient comfort, doctor's comfort, everything is better.
A lot of people in market feel that FibroTouch readings are not coherent with FibroScan, the previous machine which was there in Indian market. And as you highlighted that it is observer related and also operator related.
Yes.
If the operator is not performing the
Yes.
test accurately,
Yes.
then you cannot comment that which machine is better. Even you highlighted that a lot of FibroScan tests conducted by various companies and the reports are not right. Although it's a much
Yes.
expensive and a better machine.
Yes, that is
So
the same
it doesn't
thing.
mean that whether a machine is expensive or cheap, it should be accurately operated, for which you need experience and highly trained people.
Yes.
So this is the major reason why there is a contradiction and always a debate on readings in the market.
Yes, we also felt the same issue in 2019 when we purchased the equipment. We were also very apprehensive and skeptical whether the results are reproducible or not. But because FibroScan was out of our pocket, we could not have afforded it at any cost.
Yes.
So we went ahead with this. Initially, we were lucky enough that we had few patients who had got FibroScan done from some camps and other places, and we could see that the results are absolutely reproducible. Okay, the problem highlighted here is it's a very operator dependent test. I said observer, but it is an operator dependent test. If the operator has not taken the shots correctly or the readings correctly, then the readings may change. You know, so we have seen reproducible results. Now we don't need the need of FibroScan. We are happy with FibroTouch.
So sir, a message you would want to give to your fellow colleagues about this machine who are apprehensive like you before buying that, whether the machine is equally as FibroScan readings okay or not, because there's a lot of bubble in the market that this machine is copy or this machine is not accurate. So after 4 years, after scanning more than 5 to 6,000 patients, you have a vast experience on this. So what would you like to say to all your
I
friends?
would like to say that don't get by the rumors. We have been using it since May 2019 and we have had excellent results, good reliability. We have had not any service issues with the company. Minor issues few were there which were sorted out by NW Overseas immediately. So I would say that yes, this is an apprehension. This will always remain. If you go with something who was an innovator brand or who launched something, you know, people will always have this apprehension in the market. For example, COVID vaccines. One company launches a COVID vaccine, they will always feel that is good. But you know, we have to see what we can afford and how quality service can be given to the patients at an affordable price. You know, if we can afford a fibroscan, very well we can do it. But then the cost of the test will go high. We will have to charge 5,000, 6,000 as other big hospitals are charging. Then poor people will not be able to afford the test. You know, at our clinic we are doing it for 3,000, and there are many places in Noida who are using the same equipment and charging more also. But then we must cut down the health related cost also. So for me it is very good, very effective, and it has helped me to do liver elastography or FibroTouch examination at a nominal price for my patients.
As I clearly remember, when we were purchasing the machine, you had called FibroScan machine through a pharma company, and you called from our office, and we did a head-to-head trial on same patient, same time, and both the patients had almost same result with both the machines. So I think you can also suggest a head-to-head trial to all the doctors.
I would say it is not needed.
Okay.
Last 4 years of experience, I have full reliability with this equipment. I have seen comparable, equal results. You know, people have come to me with FibroScan. We have repeated. Initially, we did some complementary test also to patients, just to assess the FibroTouch. But I am happy. I have seen results which are comparable, and I don't need a comparative head-to-head trial now. The results are reliable.
So I'm so very thankful to you. In this past years, you have been a great support. I have myself taken your help a lot in helping this technology to boost in the peripherals. Now you yourself feel that we have installed in many small cities also, and you also feel that a lot of reports come to you. And I hope so with senior gastroenterologist support like you, we can establish more and more in Indian market, and hope one day we become the pioneers.
My heartiest congratulations and best wishes to you. I would personally like to say that this is a very good thing for preventive liver checkup. I personally feel that many people who are ignorant, they will end up in cirrhosis of liver. If we can accurately diagnose them at an early stage, we can reverse it.
Thank you, sir. It was a pleasure talking to you, sir.